Hi, I'm Dr. Felice Gersh, and I'm happy to join you again talking about important health topics related to female well being. Today, I'm going to talk to you about a very important topic that you may or may not have heard of. But let me tell you, every woman should know about this. The name that's sort of like the conventional name is Takotsubo syndrome. But the sort of colloquial name that it goes by, which has so much emotional feeling to it, is broken heart syndrome. Well, it turns out that this particular cardiac problem occurs 90% in women, and the vast majority are women who are menopausal, typically age 55 and above. So, what's going on here? Why would women get some kind of condition of their heart called broken heart syndrome? Well, first, a little background on this. It was actually only recognized in the 1990s originally, first in Japan. And it got its interesting name, Takotsubo syndrome, because what they noted was that the heart appears to change shape so that it looked like a type of an octopus trap called a takotsubo, sort of a rounded kind of a thing. And that's not a position, a shape that a heart should be in. It doesn't work well when it gets that way. And then it was investigated, like what is going on and how is this happening to women? Well, later on in the 1990s, it was discovered that a great emotional trauma can sometimes trigger this problem called broken heart syndrome or takotsubo. Now, what is happening? What it looks like is a woman has all the symptoms that are associated with a heart attack. She has shortness of breath, chest pressure, chest pain, and sometimes numbness going down the arms or into the neck and into the chin. So it looks and sounds like a conventional heart attack. But unlike a conventional heart attack, this isn't involving clogged arteries at all. In fact, it turns out that it's actually a neurological event involving the autonomic nervous system. Now, let me go back and tell you what is going on here. Well, the heart is getting what you might call a real shock. Now, what's triggering this in the initial cases that were discovered was a very great emotional trauma, like someone they loved suddenly died, or some big trauma, something happened that was just a huge emotional shock. Well, now we know it can be something very subtle. In fact, some women don't even know what triggered it, but it can also be a medical problem like pneumonia or an accident or a surgery. So it can be pretty much anything that creates a level of stress in the body. It could be one gigantic stress, or it could be a moderate stress or some stressors that occur repeatedly over time. So, what happens when women are in the menopause to their autonomic nervous system? The autonomic nervous system is what we call the automatic nervous system. It controls the functions in the body that we never have to think about, like our pulse, like our blood pressure, sweating, the peristalsis of our intestines, how our bladder is filling. I mean, there's just a load of things that happen in the body that fortunately we don't actually have to think about. They just happen naturally. Well, like everything in the body, there's that like yin yang, the balance between, like push, pull, hot, cold. So in the autonomic nervous system that controls all of these automatic functions of the body, there's the sympathetic, which is sort of like the side that deals with stress. So if you have stress, you don't think about, now I want my heart to beat faster. Now I want my blood pressure to go up. No, you don't have to think about any of those things. They happen automatically. And that's what the sympathetic part of the autonomic nervous system is about. It's about preparing for a major stressor event, like running, fighting, dealing with some kind of really big, stressful event that could threaten your existence. Now, the other side is the parasympathetic, which is sort of related to this really big nerve, which is like a big finger of the brain that comes down. That's called the vagus nerve. And the parasympathetic is the opposite of sympathetic. It's about calmness, relaxation, feeling everything's right with the world and just not having to be on guard. So you have the stress response, get ready, fight, run, whatever. That's sympathetic, and everything's fine. That's parasympathetic. Well, it turns out that estrogen is critically important to modulating or regulating the autonomic nervous system. It turns out that there's kind of a default system. When you don't have enough estrogen, everything goes kind of towards chaos. For the autonomic nervous system, it goes to pro-sympathetic. So you have more stress, more anxiety. And that's, by the way, not uncommon in women when they go through menopause and thereafter. They have lower threshold to pain, to inflammation, and to stress and anxiety. Well, it turns out that when a woman has a major stressor, a series of minor stressors, or sometimes we don't even know what the stressor is, what can happen is that the autonomic nervous system, which serves the heart. Remember, I mentioned a minute ago that it controls things like your pulse, your blood pressure. All those things are related to cardiac function. It also controls the electrical system of the brain, and it controls the electrical system in the heart that keeps the heart beating properly. So when you have a lot of stress, you may have palpitations, you may have skipped heartbeats, and so on. That is not a good thing. So this is what happens when you have stress. You have ultimately altered autonomic system stimuli to the heart, and the heart will become more stressed, as every part of the body is. It will beat harder, beat faster, beat more irregularly if things get out of control. Well, if a woman has a big stress, a series of minor stresses, she can have an overload of the autonomic nervous system's sympathetic output going to the heart that causes this major traumatic assault of stressor kinds of hormones and the effect of the sympathetic nervous system on the heart. So the muscle actually just kind of turns to like jelly. It doesn't work properly and it sort of swells. And we call that a cardiomyopathy. The heart simply doesn't work. It's like cardiogenic shock. The heart is like in shock state. And then it doesn't have the proper function. The vessels, the blood vessels that are serving the heart can go into a spasm because they too are served by the autonomic nervous system. And that's what controls the relaxation or the constriction of arteries, which helps to maintain your blood pressure appropriately when you're stressed or you're bleeding and so on to help keep you alive for survival. Well, it turns out that when you have a lot of sympathetic output to the blood vessels, the muscles will contract, causing the arteries to get tighter, narrower. So now you have the perfect storm. You have the heart muscle swelling and going into arrhythmias and kind of, dysfunctional electrical system output. You will also have the vessels serving the heart go into a constricted state. So you have an alteration of blood flow to the critically important myocardial cells, the muscle cells of the heart. So it's like a heart attack in that respect. And you have a very classical view of this on an ultrasound, an echocardiogram of the heart, where you see this characteristic swelling of the ventricle, the lower part of the heart, that makes it look weirdly like an octopus trap that they use called the Takotsubo in Japan. Now, happily, the majority of women will survive with proper medical care, but this can be a fatal event. This is really serious stuff. Now, here's another interesting thing. It seems that the incidence is increasing. It's not clear. Is it because it's being recognized more often? Cardiologists and emergency room doctors are aware of this condition that didn't really get recognized until just 30 years ago. Well, it turns out that it may actually be an increase in incidence. So why would that be? Well, we live in a world of endocrine disruptors, chemicals that interfere with the normal signaling of estrogen. So once you acknowledge that estrogen is key to proper functioning of our neurological systems, our vascular system, our heart, then when you don't have proper estrogen produced, like with menopause, or you have chemical endocrine disruptors getting into the act and mucking around with estrogen so that things are not working right, on top of losing estrogen through menopause, you have the perfect storm for an increase in the incidence of broken heart syndrome. Now, maybe it's also that we have more stressors going on in our lives than women did a generation or two ago. Like everything, it's probably multifactorial. Maybe it also has to do with the very prevalent use of hormonal contraceptives, which also alter normal hormones. And maybe that sets up sort of a pre existing risk factor so that when women go through menopause, their autonomic nervous systems are maybe more prone to creating this hyper output of sympathetic output and causing this horrible shock to the heart. So, what can we do to prevent it? Well, one thing is try to avoid chemical endocrine disruptors. Don't use plastics, pesticides, try to avoid heavy metals, and so on. And try to limit your exposure to hormonal contraceptives to the most minimal number of years that you can manage. Number two, when you're in menopause, go on bioidentical, human identical hormones at physiologic levels. Find a doctor that understands hormones and talk about your specific situation to see if you are a good candidate. And remember, starting sooner is the best. Later is still okay, but not as good as starting early on in the menopause. What else? Learn a mind body technique or more. Learn how to control stress. Learn deep breathing. Take up meditation, guided imagery. Talk to someone. Get a therapist, a friend. Don't get supersaturated with stress because stress can kill in a myriad of ways. So, broken heart syndrome, Takotsubo syndrome, is not a rarity. It's growing in prevalence. And during the COVID couple of years that we have gone through, the incidence of Takotsubo has gone up many, many fold. That's evidence of high levels of stress and also underlying infection. COVID itself could be a stressor that could induce a Takotsubo event. So be aware, be alert, do everything you can to keep your amazing, wonderful heart working perfectly. Take care. Thanks.